Hi there, our highly valued, treasured and esteemed viewers and listeners, and welcome back to your channel of choice. This video I am about to present was compiled by Dr. Nath Arawa, a clinical pharmacist by training and profession who is the founder of Progressive Pharmacotherapy Consultants, the premier virtual clinical pharmacy institute for capacity building for healthcare workers. The Virtual Clinical Pharmacy Institute with a difference, where patient safety, medication therapy management and optimal clinical outcomes are very crucial and non-negotiable to us. Here we seek to remain your premier source of crucial tips for high-impact pharmacotherapy services. So, on behalf of the Institute, I humbly urge you all to sit back and spare me part of your very precious time to share with you very useful tips which may prove very, very handy in your line of duty. I now welcome you all to part 502 of our pharmacotherapy series, which majors in anemias. FMC has just undergone a total gastrectomy for recurrent non-healing ulcers. So my next question to you reads: what form or forms of anemia would be expected to develop in a patient after gastrectomy? Should FMC receive prophylactic vitamin B12? Partial or total gastrectomy often results in anemia, particularly pernicious anemia, because the loss of intrinsic factor impairs oral vitamin B12 absorption. The hematologic and neurologic abnormalities associated with vitamin B12 deficiency do not develop until existing vitamin B12 stores are depleted, about 2 to 3 years. Nevertheless, prophylactic vitamin B12 should be administered in this patient after total gastrectomy. Because the vitamin B12 stores are not currently depleted, maintenance therapy should be adequate for FMC. The next case reads: LPG is a 48-year-old female scheduled to have laparoscopic Roux-en-Y gastric bypass, abbreviated as RYGB, surgery for morbid obesity with a body mass index, BMI, above 40. So my question to you reads: what forms of anemia would be expected to develop in LPG? When a RYGB procedure is performed, the stomach is decreased in size, and the small intestine is manipulated, creating a gastro-jejunostomy and jejuno-jejunostomy. This results in bypassing the duodenum and proximal jejunum, where iron is absorbed, resulting in iron deficiency anemia. The gastric pouch is no longer an acidic environment, which impairs iron bioavailability and functioning of iron transport mechanisms. Patients are also recommended to avoid red meat, which is a common dietary source of iron. An acidic environment is also needed for the bioavailability of vitamin B12, leading to decreased absorption. The diagnosis of vitamin B12 deficiency following bariatric surgery is rare due to the large amount stored in the body. Folate deficiency may occur from reduced dietary folate intake. The majority of folate is absorbed from the upper third of the small intestine, but may occur at any location. Iron deficiency anemia is the most common cause for anemia in bariatric surgery patients. However, other micronutrient deficiencies may also contribute. My next question to you reads: what prophylactic strategies might LPG employ to prevent anemia? Following bariatric surgery, patients will need to take lifelong multivitamin and micronutrient supplementation. Patients should take a high-potency multivitamin with 100% of the recommended daily value for at least 75% of the nutrients. It should have a minimum of 18 mg iron, 400 micrograms folic acid, selenium, and zinc. Patients should be instructed to take an additional 1 to 2 tablets per day of an iron salt, ferrous sulfate, or ferrous fumarate to prevent iron deficiency anemia. In addition to a high-potency multivitamin, patients should take 350 to 500 micrograms per day of oral cyanocobalamin or receive 1000 micrograms injections monthly. So there you have it, our highly esteemed viewers and listeners. That brings us to the end of this video. If it benefited you in any way, kindly remember to give it a thumbs up, to like it and to share it widely with your peers. Please leave your comments at the bottom. And if you haven't yet done so, I humbly urge you to subscribe to our YouTube channel. I would like to promise you all that the very, very best is yet to come. Thank you very much for viewing this video. On behalf of our senior colleague, Dr. Nath Arawa, I sincerely appreciate your partnership, continued support and kind collaboration. We look forward to interacting with you in the next video, which will be part 503.